Hi,
Hi.
visible?
Yes.
All right. Uh, Hi again, and thanks for joining another live that we have. So obviously, this is about, as the topic is, are you just feeling blue, or is it more than that? Millions of people around the world experience sadness. I'm sure like our viewers are here and at some point in their lives because of something that happened to them, they may have felt, a bit sad as a consequence of something that happened in their life. And, or they may have felt depressed. But now, like millions of people, feel that. And in India itself, the prevalence of, mental illnesses is so high. It's close to 14% of the total population according to like the 2016 survey index, and I'm sure the numbers just higher. I mean, with the pandemic after that and everything else right now. And obviously the stats are like, there are a lot of stats and numbers and everything for it, but we know that, from personal experience, like we do feel sad. It's normal. And but then how does one know that, how do we recognize whether it's just sadness we're feeling, or is it something more, something deeper, or something more persistent? So that's why we have Dr. Surali here, a psychiatrist practicing in Mumbai, to tell us that, the very difference between us and a bit more, which we'll see in the coming time. So, Dr. Surali, hi, thank you for joining. So my first, point of discussion, question to you would be, like I said, like how do we differentiate between, sadness or and depression?
Hi. It's a pleasure being here again. And happy Ganesh Chaturthi to everybody. Happy Ganesh Chaturthi to CareMe. And thanks for
Thank you.
conducting these live sessions every weekend, which are very relevant and very significant. Um, so coming back to sadness, when we talk about sadness, let's go back to the basics of where this the because sadness is an English word. It's a terminology which is commonly used. It's a lay word, uh, but it's a feeling. It's something that you experience. So let's talk about feelings. Feelings is nothing but a subjective experience. It's something I feel. It's something you feel. It's something everybody feels. So it's a subjective experience. It can be a positive experience. It can be a negative experience. It can be something as much as, okay, I feel exalted. I feel ecstatic. I feel so excited. Or it can be, I feel so sad. I feel so angry. I feel so disgusted. So this is kind of an umbrella. Feelings are an umbrella term, which is a reaction. It can be normal. It can be a normal reaction. But when we talk about emotion, now an emotion is a stirred up state where you feel that, okay, there's something more than a feeling. It's something more than just feeling sad. It's about it's about experiencing bodily changes. It's about experiencing certain physiological changes, or say, when you there is a feeling and there is racing of heart, or there is a feeling and there's excessive sweating. So a lot of bodily changes. Say there is sadness, but along with that there's a lot of tiredness, there's a lot of fatigue. So emotion is basically a stirred up state with physiological changes. Then the third term that is very commonly used is mood. Now, mood is nothing but a pervasive and sustained state of emotion. So when I say, okay, I feel sad, but it's something like a reaction. When I say, okay, my current state of emotion is sad, and this has been there for a very long time. Say it's been there for 2 to 3 weeks, or it's been there for at least 3 to 4 months, or it's been there for a long time, and it's not changing at all. It's sustained, it's pervasive, it's persistent, and that state is what we call as mood. Now, mood, either it can be you know something which is elation or ecstatic or excitement. It can be a positive mood or it can be a negative mood. That is that you're feeling low, your mood is low, but it has to be persistent. It has to be for a longer period of time. It just can't be for a fraction of a second. It can't be for a just couple of hours. So mood, it can be described with the intensity, that how bad am I feeling. I'm feeling extremely sad, or I'm feeling okay, I'm feeling a little bit sad. It can be described as for a duration, that is okay, I'm feeling sad for a couple of months now. Or it can be described as having fluctuations, that okay, last couple of months I've had a lot of fluctuations in my mood. So this is how you describe mood. And these are the basic differences when we talk about feelings, we talk about emotions, we talk about uh, mood. And it could be normal, it could be as good as a normal reaction, or it can be something which may need some help. It may go beyond the normalcy. Now when we talk about normalcy, it's for example, if we uh, take an event that is a loss. It could be loss of a person, could be loss of a relationship, it could be loss of a dream, it could be anything. It is just loss, and that loss can lead to a grief reaction. Now that reaction is something which is considered normal. It's expected to feel a certain way. And uh, on an average, if we see such reactions would say it would last for a couple of weeks, it would last for a couple of months. It may not affect the functionality of the individual. Say to an extent, it may affect the functionality, but if it is beyond that, if it goes uh, you know excessively prolonged, then that is somewhere which you know uh, we should think that okay, there's something wrong. It's not ending, or it's not getting over, or I'm persistently feeling a certain way. It could be because of events like death of a loved one, or break of a relationship, romantic relationships, when somebody is just not able to move on, or they're just not able to forget the person that they have lost. Not forget, but just able to come over the emotional experiences after a lost one. you know um, and importantly, the functional incapacity, where after a usually grief reaction, the expectation is that a person can come back to the routine in a couple of days, or say maximum for a couple of weeks. That's where we say there is a working class, a person who goes to office, and now the person has lost a family member and is going through a grief process. Now, how long should this person ask for leave? How long will that person take to recover? So it depends on an individual to individual basis. And this is somewhere where the normalcy, the average reaction comes, and beyond that is somewhere the area of requiring help or requiring support comes.
Right. Okay. So thanks so much for this insightful answer into, like, what it means to feel a certain emotion, and how to sort of how it moves on to like mood, or like how it can be different if it's, pervasive and like, quite persistent in nature. I'm sure like our viewers, would have really you know gained some information and insight from that, as did I. So I just want to know next, I would think, so how, like, if it's just an emotion, a reaction, like you said, how does one cope with that emotion? It may not be persistent. Maybe, someone's going through a breakup, or someone's going to a very sad time. Maybe just, they got a rejection from a job or something like that. Like, how does one cope with that kind of sadness?
So as I really consider that say loss of a relationship, loss of a dream, rejection. These are really, I consider them as emotional injuries, where just like how every wound, every physical wound needs time to heal, it needs a certain kind of care. So even emotional injuries, emotional turmoils need a certain level of care. They need time to heal. So I think care and time, together will heal the individual from these emotional injuries. It could be micro injuries, it could be, day to day basis injuries or emotional injuries. But it needs a certain level of care, and it differs from individual to individual. Even the time needed to heal differs from individual to individual. With
Yeah.
time, the individual learns to cope with these situations, these circumstances, the environment, and it's just if with time they learn, and if they're not able to learn, then they definitely can reach out to somebody they trust, or they feel that they can receive help from a certain, be it a mental health professional, be it a family member, be it a friend, be it a loved one, could be any.
Yeah. So when you say, care for these things, like, would you like elaborate for us, like in what small ways could one care for ourselves and not, try to spiral with these, emotional injuries as you suggest?
Yes. So I think it's a lot to do about your self awareness, um, how you feel on day to day basis, being in touch with yourself. Also about being able to openly express how you feel, and that is where the role of the environment also comes, where you feel that okay, the environment is not conducive for me to express myself, then that individual will shut down, and may not be able to express. So I think it starts with being aware about your own feelings, emotions, how your mood state has been. Usually
Yeah.
we ask individuals to keep a mood chart, make a note of how you make a note of your budget every day. So you can make a note of how you feel every day, how your mood has been. Have you experienced any kind of anxiety, or any physical symptoms which are connected to your emotions? It's a lot to understand these things, and I think we
Hmm.
don't have that much of uh, emotional literacy. I don't know if that's a term, but it's a lot to do with being in touch with your own emotional states, your own mood,
Yeah.
and I think it's a journey. It takes time to identify these things, as an individual.
Right. Thank you. So, basically, we should keep in touch with ourselves and our environment. And that's just the beginning of the process of healing
Yeah.
from the emotion, that is, right? So coming to, so what happens when these emotions persist for a very long time? What if we start to feel a little bit more, that then it's just an emotion or a reaction and it's maybe just becoming like a part of our lives. What happens then? What is that? And like, how does that look like?
Yes. So, when these emotions stay for a longer period, they're just not uh, they're just not going away, even with your present coping skills. You're trying to cope with them, but say the environment is not conducive, you're constantly under stress, you're constantly under, say for example, there was uh, the pandemic, the people were losing their jobs, there was a threat of going unemployed, the financial crisis, people getting stuck in their homes. So the uh, environment being not conducive, or not in your control, and you're trying to cope with it, but you're not able to cope, and that's where this we give examples of, say, there is a rubber band, and we keep stretching the rubber band, and there is a point where the rubber band breaks, or say we're filling a glass with water, and there's a point where the glass overflows, or we're filling a balloon and there's a point where the balloon bursts. So these points, they are determined by multiple factors. Could be your genetics, could be your personality, it could be your environment. And that is the point where, you know, uh, which could be identified as, okay, this has precipitated something into something which does not seem usual, it does not seem normal, or this person is more than more than usual sad, or it's been quite dysfunctional in the last couple of months. And that's where we call it as a depressive disorder. When we talk about sadness, that's where we call it, technical terms used usually are major depressive disorder. Or when there are multiple episodes of depression, we call it recurrent depressive disorder. And there are various technical terms used for it. But these have a certain set of symptoms where the usual normal reactions are, they become the extension of themselves and they end up into symptoms. The symptoms, it could be related to your own routine, such as not able to sleep. So, say in a grief reaction, that could last for a couple of days. You know, when you're grieving over a person, you could not, may not be able to sleep for a couple of days. Then eventually, gradually, it heals and you heal and you come back to your normal routine. But when it is depression, you may not be able to sleep for a long period of time. Say that it's been 2 to 3 months I have not slept well, or I just can't, I just can't fall asleep. Or it's commonly seen in depression, which is terminal insomnia. That is early morning awakening. That I wake up early in the morning, 3 o'clock, 4 o'clock, and I just can't fall asleep again. And I feel extremely sad when I wake up in the morning, or I just can't get up from my bed when I wake up in the morning. Or it could be such that I can't, I can't feel that appetite I used to feel. I don't feel hungry enough. I don't feel like eating anything. Or it could be opposite as well, where the person is extremely, overeating or excessively sleeping. But that's sometimes it's those are on rare cases. But mostly it has been, low sleep, low appetite. Other than that, low in energy levels, low
Hmm.
in the self-esteem, low self-confidence, low concentration levels, and more importantly, persistent sadness, or persistent and pervasive sadness, which is that
Hmm.
do anything but the sadness is not improving, or just inability to feel pleasure. The technical term used for it is anhedonia.
Hmm.
Hedonism is pleasure. When the person is not feeling the pleasure, it's anhedonia. So that
Hmm.
is a very classic symptom of depression. And these are, along with that, very importantly, depression comes with a really black cloud on the head, and it's it presents with a lot of negative thoughts about yourself, or that I'm very worthless, I could not do anything, or it's about your future, that I don't see a future, I'm feeling so hopeless. Or it could be about your environment, that nobody's helping me, I'm feeling completely helpless. So these are a lot of negative thoughts. And in severe cases, in severe depression, we can also see self harm at some instances, self harm, suicidal thoughts, suicidal behaviors, suicidal attempts. And these are a certain set of symptoms which will differentiate between what is called as a depressive disorder, or a depression, clinical depression, and from a normal emotional reaction.
Right. Okay. So that's a lot to, process, but thankfully our reels are saved. So I think the viewers, if, they want to take back something, just for themselves, obviously for informational purposes, they can definitely, come back to this reel, just go over it and understand the difference between, whether they are feeling what they're feeling is, just an emotion, just sadness, or if it's a little bit more than that, but coming to that point, obviously this reel is not enough. It's just going to be 30 to 40 minutes of us, letting them understand what they're feeling momentarily. Like 30 minutes of help is not enough in case it's a little bit more than emotions. Obviously,
Yeah.
we all know that. So how does one then, know that, okay, yeah, a reel is not enough. What should I do next? Like,
Yeah.
when we're calling them, if sadness is an emotional injury, then obviously depression is a little bit more of an intense injury, right? And for that, we must go to a doctor.
Yeah.
So, like, when would be the time to, for us to understand that, now I think I need to get some professional help.
I think it's mainly when you feel that you're just incapacitated, or you feel that your routine is getting disrupted, you're not able to focus on your work, you're not able to move ahead, or you just feel that feeling of stagnation. A lot of times it's an individual cannot process this when they're depressed, so it has to be by the caregivers, by the loved ones, who identify these symptoms, and they initiate uh, the the individual to seek help, or they try to take them to a mental health professional, or take them to a psychologist, or just uh, take lead basically. If not
Yeah.
caregivers, and if an individual is capable enough to identify that these are certain changes that they're noticing, and it could be at a very early stage, something as early as mild depression, which could be treated with therapy. It may need a very low dose of medicines, or it could be somewhere in the middle where it is it's moderate depression, or it could be as something which is a severe depression. It needs aggressive treatment. It needs faster recovery, and earlier you identify, earlier you initiate the treatment, the faster the recovery is. Often patients ask that how long do they have to take the medicine, how long do they have to continue taking treatment. uh, Medicines is a completely different ball game. It's a different discussion altogether. But
Yeah.
it's depends on how chronic the condition is. If your depression is not treated for say 3 to 5 years, and your 3 to 5 years you're constantly underperforming, or you're not functioning well enough, or you're just uh, suffering from depression. Depression is the most common, is the leading cause for highest DALYs. DALYs is disability, associated living life years, where depression is seen to be making people, not live up to the mark, or not able to give their 100%. And uh, it's to identify that as soon as possible, to initiate. And if it is something which is chronic, it may need that much amount of time to recover. The recovery is a different discussion altogether.
Yeah. So, I mean, definitely then, with this information, I understand, and, we should understand that it's really important to go to, like a psychologist or, a psychiatrist where we feel comfortable, and then obviously get the required guidance from a professional, and not try and, like, do it ourselves, which we hear time and again, but like, people just end up, like how sometimes we just take over the counter medicines by ourselves. It's just like, okay, yeah, you know what, I'm just gonna do some things that may help me in the, short period of
Yeah.
time, and then not
And
kind of
there's a
follow up with it.
lot of stigma because of which such behaviors persist. It could be, self
Exactly.
stigma, that is, oh, I cannot feel a certain way, I should not feel a certain way. It is a lot of self stigma that leads individuals to not seek help. There's also stigma which is from the external environment, but it's mostly it's a lot of times self stigma.
Yeah.
And
Yeah,
I
with
think
mental health, I think it's just this is such a pervasive challenge. Like it's so perpetual, and you can be working, so hard to try and like tell people that it's okay not to be okay. It's okay, go to a doctor. We're there to help you. It's all confidential. But then again, because of this stigma, I mean, there are so many people who would first of all, like, refuse to accept that there is a problem. And even if they feel and know that there is a problem, it's so hard to just accept to ourselves, or, it just then becomes impossible to accept that to someone else, or obviously, like a doctor is very easy to do that because, if you did take that big step, I think the biggest like challenge that you've been able to, overcome. But again, because of this, like I think, to help that stigma, I'm thinking, why not like tell our viewers or whoever will watch this live in the future what exactly happens when one goes to a professional, like, you're a psychiatrist yourself. So how would you speak to a person? I'm like, what exactly are the steps that happen when a, person comes to seek help? And that is obviously after they've been able to accept that there is, a problem itself. So just a few things if you could explain.
so just like every other consultation, when say you're going to show a doctor about your physical complaints. So it's exactly like that. You come to a psychiatrist or you come to a psychologist or you come to any mental health professional, and the professional will ask that how can I help you, or if the individual does not start the conversation, the professional will ask. They will initiate, and once you start expressing how you feel or what is bothering you, uh, you know we try to identify what's happening. We try to make a diagnosis, and we try to identify how severe it is, what is the intensity, and are there any precipitating factors, or are there any maintaining factors. These are the part of the clinical evaluation.
Hmm.
Other than this, say if an individual needs a certain investigation, say for in depression, hormonal disorders are quite commonly seen. For say in females, hypothyroidism is commonly seen, or or say overall, you know not just females but thyroid issues. It could be thyroid. It can be as simple as anemia, or just basically physical issues because of which individual, or it could be a stroke, or it could be just diabetes, chronic diabetes. These are certain biological or endocrinological hormonal conditions which depression is associated with. So we try to investigate whether there are these uh, you know uh, factors that are affecting. Uh, then, other than that, if there are any personality issues, or other than that, I mean, personality comes a bit later, but we try to treat the depression. We try to help the patient or the client recover from depression. So, depending on the severity, be it mild, moderate, severe depression, we start a set of medicines where they're very commonly called antidepressants, because they reduce the level of depression. They reduce the level of symptoms that you're experiencing in depression. Basically, they just target the brain chemical system, which includes serotonin, norepinephrine, dopamine, and these chemicals are adjusted with the help of the medicine. And once the patient or the client is stable enough, they can, or it usually started together, but they undergo therapy, or it could be as simple as supportive work where the individual is allowed to ventilate, or or given a lot of support or validation. It could be something which is very technical, or such as CBT or cognitive behavioral therapy, or it could be about interpersonal skills. Depends on an individual what skills they lack, what are the factors, that personality factors that is making them more prone for depression. And the third is the environment. If it's in the control of an individual, we can make certain changes in the environment. Otherwise, it's very difficult to control the environment. So, say if an individual is feeling extremely stressed, persistently stressed, and it's on the verge of depression because of a job, or because of a certain stressful job. So, resigning, or if the individual wants to continue, uh, helping them cope. So that's where the part of therapy comes. Or if the individual feels that, okay, I want to resign so that I have my peace of mind. So resigning would be change of environment. So these are, strategy. It depends on individual to individual. It's like a teamwork. So it starts from identifying, investigating, then team making a teamwork, like that.
Yes, exactly. So, like you rightly said, it's all like, a teamwork, like a multidisciplinary effort that goes into this, So just because you mentioned, the physical symptoms that start showing, or the physical problems that, women or sometimes men start experiencing because of, a mental health condition. There's actually a question that our viewer has asked us. So I'll just find that question and let you know what that is. Yes. So I think a viewer has asked us, can depression be linked with gut changes like bloating? So,
So bloating itself, so there it's a completely different area about the gut brain axis. It's quite technical, even I need to read up on that. But if we're talking in terms of bloating, then is it something to do with the gastrointestinal system? Is it that, and the individual is suffering from a condition that is abnormality in the GI system, or uh, is it something which is neurological, or um, uh, uh, like I don't want to use the term here, but there's a condition called as IBS, or irritable bowel syndrome,
yeah.
where an individual experiences extreme level of anxiety along with certain mood changes, and it's a lot to do with the neurochemical system. It's a lot to do with the, serotonin, norepinephrine, dopamine, and these chemicals are not just present in your brain, but they're also present in your gut. So that's why the gut brain axis.
Yeah. So I think, yeah, exactly. Like, I think tackling a question like that is very much subjective to what the person's experiencing emotionally, physically. Um, and even with, like you said, like, I mean, it is linked that women do, experience these physical problems. It is after, a series of tests and, just a conversation with your, physician and your, like, other side of things, like getting psychotherapy, treating that first. And in case it, like, starts to, cease, and, just sort of factoring in all of that is also very important. So I think if we start asking questions like that, then there's definitely something we've been, I think, thinking, that, that I think the person who asked that question, it could be like, are you, the first question would be like, are you, feeling
Suffering
more
from.
stressed than usual? Yeah, exactly. And are you also suffering from something like that? So first would be to just start to look at these problems separately, bifurcate it and compartmentalize it, and then go for that help that you do feel that you need more importantly. I mean, bloating is something that women, I think the kind of food we Indians eat as well is like so easy to feel bloated as well
Okay.
after that, or
Around menstruation,
exactly.
it's
Yeah,
a
so
very
every month.
uncomfortable, situation to be in, and it's very distressing.
Yeah,
It's Our mind and body is very connected. If a body is under distress, it gets affected in our, it's seen in our mood, it's seen in our how we feel. Equally, when we
exactly.
feel a certain way, our body gets affected. Say I've been feeling depressed, that is, I am suffering from depression for a long period of time, it's untreated, so it will affect my body. Although,
Yeah,
if I'm trying to push myself, I'm trying to work as much as possible, but my body is not, it's just not helping me, because there is an underlying depression. So it's body and mind both are connected.
yeah, exactly. I mean, that that point, I think, is, something that we all need to remember when we're thinking about these things. It's not just this or that. It's
Yeah.
always like, something affecting the other. It's like we're one, like mind, body, brain. It's gonna affect us, and I think on that note, we can, safely say that, it has been a definitely like, enriching, comprehensive discussion about what depression is, what sadness is, and, how the different ways to treat or manage both of these, conditions or emotion, mood, and, just go for the help that we need, cannot be said enough times. So I think on that note, we can definitely end this live. Again, thank you, Dr. Surali, for joining again for a second live. You have been
Pleasure.
so informative and helpful to let us know all these really, really insightful things. And I hope we'll see you again for another live very soon. Um,
So,
Thank you so much for joining. And thanks everyone who is watching us.
bye.
Bye.